Hey there! If you're getting ready for childbirth, I bet your mind is racing with a million things, right? Well, today we're going to focus on just one of them, perineal massage. It sounds a little clinical, but stick with me. It's a super simple, science-backed trick that can honestly make a huge difference for your birth and your recovery. So let's just dive right in.
Okay, let's just get right to it. The big one, tearing during childbirth. If you're pregnant, I'm almost certain this thought has crossed your mind, maybe more than once. And look, it's a totally normal fear. It's a big deal. But what if I told you there's something you can actually do about it? Something proactive to get your body ready and maybe, just maybe, lower that risk. You know that old saying, an ounce of prevention is worth a pound of cure? That is exactly what we're talking about here. Being proactive, man, it's so empowering. It's about feeling like you have some control in the process, you know? And it can genuinely lead to a way smoother recovery after the baby arrives. It's all about working with your body, not just letting things happen to it. So let's get into the how and why, the science of the stretch. It sounds kind of technical, but the reason this works is actually pretty simple. It's all about getting those tissues ready for, well, for the stretch of a lifetime. Okay, I love this analogy. Think about it like this. Imagine you bought a brand new pair of stiff leather shoes, and then you tried to run a marathon in them the very next day. Total disaster, right? Blisters, cracks, the whole thing. But what if, for a few weeks beforehand, you gently worked some oil into them, stretched them out, they become soft, flexible, ready to go? Well, your perineal tissues are kind of like that new leather shoe. A little prep work helps them get elastic and ready so they can stretch without tearing when the pressure is on. So when I say perineum, what am I even talking about? It's pretty simple. It's that area of skin and muscle that's right between the vaginal opening and the anus. And during birth, when the baby's head is crowning, wow, that little area has to stretch an unbelievable amount. It's like the final gateway. And that's the whole point, right? The goal here is to get more blood flowing to that area and make the tissue way more elastic. When it's more supple, it's less likely to tear badly. It also might help you avoid an episiotomy, which, is that surgical cut doctors sometimes have to make. So yeah, it's all about making things a little easier down there.
Okay, enough with the why. Let's get to the how, the practical stuff. This is your step-by-step guide, your action plan. It's a super simple routine you can start doing in your third trimester. First up, the schedule. Timing is everything. You'll want to start this around week 34. The sweet spot is about 3 to 4 times a week. Fun fact, doing it every single day doesn't actually seem to add any extra benefit, so don't stress about that. And get this, each time you do it, it's only for about 5 minutes. Seriously, that's it. You can do this while your tea is brewing. Now, what kind of lubricant should you use? This is important. You want to go for natural, unscented oils. Sweet almond oil is a great one. Coconut oil, even just plain old olive oil from your kitchen, or vitamin E oil. What you want to avoid is just as important. Stay away from synthetic baby oils, anything with perfume or scents, and definitely avoid really strong stuff like mustard oil. That area is super sensitive and you don't want any irritation. All right, let's walk through the actual technique step by step. First things first, get prepared. Wash your hands really well, make sure your nails are trimmed, then find a comfy spot. Propped up on some pillows in bed works great. Second, lubricate. Put about a teaspoon of your oil on your thumbs and on the perineal area itself. Okay, step 3. You're going to insert your thumbs just about an inch or an inch and a half into your vagina. Now press down toward your back like you're pressing toward the 6 on a clock face. And finally, the massage. Gently sweep your thumbs outwards and upwards, making a U shape, kind of from 3 o'clock over to 9 o'clock. You should feel a little stretch, maybe a slight tingling or burning feeling. That's the sweet spot. That means it's working. Hold that for a minute or two. The whole thing, start to finish, should only take about 5 minutes. Okay, now for something really, really important. The safety rules. When should you not do this? Because while it's super safe for most people, it's definitely not for everyone, and it's crucial to know the difference. So these are the absolute do nots. Do not do this massage if you have a low-lying placenta, also called placenta previa, or if you think your water has broken, big no-no. Also, if you have a cervical stitch, a cerclage, or are at risk for preterm labor. And finally, if you have any kind of active infection down there, like herpes or a yeast infection, in any of these cases, just don't do it. And honestly, when in doubt, just ask your doctor. Always better to be safe. And what about warning signs while you're doing the massage? Part of doing this safely is knowing when to stop. So what are the red flags that mean you should stop right away and give your doctor a call? Okay, listen up. Stop immediately if you see any real vaginal bleeding. I'm not talking about a tiny little spot, but active bleeding. Also, if you feel a sudden gush of fluid or a constant leak, that could mean your water broke, so you need to stop and call. And last one, if you feel a sharp, burning pain that sticks around for hours after you're done, that's not the normal tingling stretch. That's a sign to call your provider. All right, let's move on to one of my favorite topics, myth versus reality. There are so many old wives' tales and cultural beliefs around childbirth, right? Let's separate the facts from the fiction.
Okay, let's debunk a big one. You might have heard that drinking ghee, or even worse, castor oil, will lubricate the birth canal. Let me be super clear. That is a myth. It's biologically impossible. When you eat or drink something, it goes into your digestive system. It doesn't magically appear in your vagina. And castor oil, it's actually really dangerous to drink during pregnancy. It can cause awful dehydration and put the baby in distress, so please don't do it. Lubrication for this purpose has to be topical, meaning you apply it on the outside.
Here's another one. Is it safe to even be touching that area? Could I cause an infection or hurt the baby? That's a totally fair question, but the reality is, it's completely safe. As long as your hands are clean and you don't have any of those conditions we talked about, you're good to go. Remember, the baby is tucked way up high, safe and sound behind your cervix. You're not getting anywhere near them. Okay, so let's zoom out. What's the big takeaway here? This is about more than just a massage technique. It's really about taking control. It's about shifting your mindset and playing an active part in your own birth experience.
Because when you get right down to it, preparing your body like this, it's an act of empowerment. It's you taking charge. You're using an evidence-based method to help your own recovery. And hey, it's one less thing to worry about, so you can put more of your focus on that amazing new baby you're about to meet.
And think about the return on investment here. It's huge. We're talking what, maybe 15 minutes a week? That's it. For such a tiny time commitment, you could be setting yourself up for a much, much more comfortable postpartum recovery. Seems like a pretty good trade-off to me. So I'll leave you with a question to think about. What's one thing you can do this week to prepare for your birth? It doesn't have to be this massage. Maybe it's packing your hospital bag or practicing a breathing exercise. Just what's one small thing you can do to feel a little more in control and ready for what's to come? Thanks for tuning in.